My relationship with Baptist has been a multi-year process, as initially it was volunteering and sort of confirming my passion in the medical field and helping people, but really it evolved into more of a partnership. What most people consider sort of the final part of one's Eagle Scout rank, besides the actual board review, is the Eagle Scout project. I decided to do something a little bit different with my project, in which I wanted to address a situation in my community that also intertwined with my passion, which is the betterment of everyone living. That came out to be the drug take-back, which, as my father is in law enforcement, we'd had various talks about substance abuse across the U.S. And so I obviously knew that, especially the opioid crisis in Kentucky is quite a serious issue.
We do know that in Kentucky alone, it's estimated that 15,000 teenagers took a prescription medication that was not intended for them. Statistics show that 80% of people who use heroin started out with a prescription medication. A drug take-back is a relatively new concept in the last few years, whereby certain places are authorized, and we do this with a cooperation from our communities and our law enforcement, to take back medications that are no longer wanted by individuals in their homes.
In order to most effectively carry out my drug take-back, I proposed it to Baptist Health of Grange. Their community health fair was then suggested to me as a possible time.
We love to reach out to the community at Baptist LaGrange in so many ways, and one of the ways we do that is a health fair, and it's always very well received, and the community's very excited about it.
I felt that the drug take-back was very successful. We amassed 32 pounds, which is a significant amount of unused drugs, which, instead of being flushed down the toilet or falling into the wrong hands, were properly disposed of.
This partnership with NOAA was one more example of how Baptist reaches out to the community. Baptist is open to community ideas and to things that will help make our community safer and healthier, and that we are proactive. We have such a great relationship with our schools and our law enforcement. We feel like literally we are family here, and that we're taking care of each other. And I think that exemplifies what Baptist is: family, taking care of each other.
Just seeing all the effect that the project had, the 32 pounds of drugs that were brought in meant there were 32 pounds of drugs that weren't in people's cabinets or flushed into the water supply. Even if it's just in this community alone, anything can help, the overall crisis, and even my contributions can make a difference.